At the end of the day, we all need to be able to communicate with our surgeons and communicate with families to understand what operations and interventions our patients are going to need.
The only way to completely understand the anatomy of congenital heart disease is to be able to look at specimens, or the electronic equivalent of looking at specimens, and that is three-dimensional reconstructions of specimens, which is what this technology allows us to do.
3D cardiac pathology specimens within Cardioscape give learners an understanding of what the actual structures they're reading about in textbooks look like. This is something that you don't get from still frame images.
The importance of this is really its educational value and the archiving value, the fact that these images are going to be here in 50 years, whereas the heart specimens may not.
Most of us who curate registries now have collections that are getting older and older, and eventually these specimens do get taken out of the educational pool. As we've become much better with keeping our patients alive for longer, we just don't have new hearts entering these registries.
These specimens are not replaceable. I mean, there's no way to get these again. And many of our specimens are 60, 70, even 80 years old. And the more we handle them, the more we use them for teaching, the more they deteriorate. And so they're eventually going to not be suitable for teaching, really, because of the wear and tear on them, just from using them and just from time. So having them archived in an electronic format where they won't deteriorate is really essential. I mean, this is the only way we're going to save these for really long term.
So Cardioscape has offered me the best and, quite frankly, the only platform on which to share 3D models as specimens from our registry. I think what sets Cardioscape apart is we've built it specifically to house and render these heart specimens.
I'm going to be using the digital cardiac pathology registry that Cardioscape has provided to teach pathology. There's no better way to teach it other than going to a lab, rinsing specimens, but you can bring up Cardioscape within a minute and be teaching from real cardiac specimens and really answer questions on a minute-by-minute basis.
If you're trying to learn about a heart, what better way to learn about it than looking at a heart itself?
It teaches people anatomy, both surgeons and cardiologists, so that they make correct diagnoses and understand what they're looking at in the operating room.
And while echo and CT and MRI data sets are all very helpful, they don't necessarily show all the fine details. And it's also different when you have a heart in your hand and you can actually move it around and manipulate it to see exactly what interest you have and what questions specifically you're trying to answer.
The project is for a lot of people. It's for fellows, for surgery residents, for nurses, for technologists, not only in this country, but probably more so in other places where access is much more limited or not available at all.
Cardiac registries are truly unique. I can tell you there are not very many. In fact, there are some countries by law where you're not allowed to retain biospecimens, including hearts.
So that's my idea, is that we would collect these from various sources that have these available and put them together into a database, into a repository that would then be available for whoever needs to have access to them. And that, maybe people in the United States or in Europe, but also in developing countries or in countries where for cultural or religious reasons, autopsy is not done, then these specimens would be available for teaching and learning under those circumstances.
What's truly special and unique about Cardioscape is that it's free. There's no strings attached. There's no in-app purchases or anything. Someone can just go to download Cardioscape, install it, and log in and just start using it.
So it's been critical that the physicians and our technology team at Cardioscape has worked really closely together to make this a reality. And I think the profession will really benefit from that collaboration with Cardioscape in a way that I don't think we've seen a lot in pediatric cardiology because we are such a small profession.
When it came to Cardioscape, it was just a perfect relationship, and it made complete sense once I got exposed to Cardioscape and its vision. was that this was going to be the way that we can move registries forward. If we can't make registries bigger and we can't get new hearts in, how do we preserve the data in these registries? And that's why Cardioscape really means so much to me, because I fear that registries won't be around for too much longer. And I fear that people won't have these resources. And for me personally, being able to preserve some of this data digitally for people to use in the future is just super helpful.
One of the benefits we have had working with Cardioscape, that not just the physicians involved, but the technologists involved have been willing to go to each of these sites. We've gone to Boston, we've worked with Stephen Sanders, we've gone to Chicago to work with Rohit Loomba, we've gone to CHLA and worked with Pierre Wong, and had each of these physicians stage their own specimens. Stephen Sanders really graciously offered his time and spent multiple afternoons with us staging these specimens. And because of how intimately knowledgeable he was of the pathology itself, he was able to hang these cardiac specimens delicately from these riggings that had been set up in order for the Cardioscape team to capture them digitally once and for all. He was very invested in this, obviously, because he knows that these specimens won't last forever. And if we can immortalize them digitally in the way that Cardioscape has, the value to learning and the value even beyond what he's able to do at Boston is made clear when you use the software.
I had reservations in the back of my mind. Then the Cardioscape team came out to Advocate, where I was at the time, and we had a large registry there, the Lev Archive, with about 3,000 specimens, and we spent about a week just scanning specimen after specimen. And honestly, after like the first scan, it became very clear what this technology really could do. Right? We were getting very good, clear, high-resolution 3D models of these specimens.
Yeah, as far as archiving these is concerned, we've started doing that a long time ago. We initially started to build a website that had movies. And we did this for a little while, but it got to be very difficult to host this application. It became impossible for us to host it within the hospital because of the firewall and make it available outside. So we sort of let it go by. So this project seemed to me to really bring a dimension to archiving these that we've not had available before, and that is to have really a real photographic representation of it, but in a three-dimensional image so that it can be manipulated. You can move it around. I mean, movies are very nice, but it's what the demonstrator showed, and that's it. You can't do anything else with it. If the student or the learner wants to explore some other aspect of it, can't do it. But with these type of projection of the specimens, then the learner can manipulate it, can explore things on their own. So I think that's a really fantastic aspect of this project.
These registries really do hold a very big historic importance for us outside of even just education. A lot of these registries have really been the hallmark, the pinnacle of where we've gotten our cardiac anatomy and cardiac pathology issues sorted out from an academic standpoint. And some of the grandfathers and grandmothers of our field come from the cardiac pathology world or have been very involved with it. People like Maud Abbott, Bob Anderson, Richard Van Praagh, Paul Weinberg, or Steve Sanders, all these people who have really been able to leverage registries in cardiac anatomy and cardiac pathology to really educate people and help with the clinical advances those people have been able to make.
When I was a fellow, this was part of our rotation, was to rotate through the cardiac registry and help the Dr. Richard and Stella Van Praagh with autopsies. And when we were starting out in the 70s, when we really first started with echocardiography at that point, we didn't really know how to use it to diagnose congenital heart disease. We didn't know for sure what we were looking at on the screen. And so it was very important for us and for other people who were at the beginning of this imaging specialty to have access to specimens so that we could compare what we were seeing with clinical imaging with the real thing.
Although there's no replacing lab time, being able to physically be with a pathology specimen, One of the benefits of having it be digitized and in such a readily accessible format is that a student doesn't have to wait around for their pathology instructor. They don't have to schedule a session. They don't have to physically go over to the pathology lab and rinse a specimen and take the time to prep the specimen before viewing it. These hundreds of cardiac specimens are available at any time, day or night. And I think it'll be an incredible boon to the education of pediatric cardiologists, adult congenital cardiologists, and cardiac surgeons who really need to understand the three-dimensional nature and physiology of these hearts in order to perform the important work that we do.
I've always wanted to create like a network of registries, of cardiac registries across the world. I know that there's so many wonderful registries around the world, and people have some truly unique hearts in my registries that might not be available in other registries, and that other registries might have that are not available in my registries. And I think the way to truly make a platform like Cardioscape as helpful as it can be is to really have everybody contribute to it. And so I would really encourage other people who curate or oversee cardiac registries to reach out and collaborate with us to try to get more and more models uploaded into Cardioscape. And whether or not they feel comfortable with the 3D scanning, certainly something that we're always can work on together and collaborate with. But I think with the technology today, it's so simple to really create these 3D models, get them uploaded, and make them available for everybody. I think our registries and the specimens, the patients who contributed these organs and the families that allowed this to happen, everybody benefits from allowing more and more people to get educated using these really invaluable organs that we have at our disposal.
Not everybody has everything. So the idea would be to create a wish list, if you will, basically everything that we can think of, and then look for several examples of each one from various institutions. And, some people are going to have one thing and others don't. And so in that sense, it would be a really collaborative effort. And it would require a lot of communication, a lot of working together to figure out who has what and how to get it into the repository. And I think this provides that kind of motivation and opportunity to really get the organizations that have these resources available to really work together and make this be a really big project.
We hope that every pediatric cardiac institution and even any adult congenital heart disease training institutions in the country that want to use Cardioscape do use Cardioscape. We're making it freely available for that reason. Into the future, we hope that all institutions that have cardiac pathology registries would be interested in using Cardioscape to digitize their registries and to capture their own specimens, their own collections for their institution and for Cardioscape in general.
It would be really nice to make this be a very comprehensive archive so that it had not only specimens, but similar clinical imaging studies, echoes, magnetic resonance, CTs, 3D reconstructions from some of those. So something really comprehensive like that would be what I would like to see this eventually become.
With our current registry, we plan to build toward that by allowing uploads of cardiac MRI, cardiac CT, and other imaging modalities that will accompany our other specimens so that when you're looking at a pathology specimen in 3 dimensions with a video tutorial, you might in the future be able to bring up a cardiac MRI that matches that specimen so that you're learning what you'll see in the OR, what you'll see in terms of patient physiology, and then what you'll see with imaging.
Cardioscape also has a virtual reality platform in which you can actually view the models and manipulate them in VR. And so I think that can really be the future of Cardioscape. You don't just have to manipulate it on your screen. You can actually put some 3D goggles on and get your hands on this heart, move this model around, and really feel like you have the model in your hand. So certainly use it. It's definitely the platform I prefer to use. Of course, I'm biased because I've been heavily involved with it, but that's because I truly believe in it. Like I said at the beginning, I had reservations, but its utility became very, very obvious very quickly. So it's actually one of the most exciting things I've been involved with in my career.